And let's start. Smile design rules. They probably did not teach you at the university. Well, here are the top demanded smiles of the patients. And I want to come back to these smiles later, after we have learned about the smile design rules, and we just see these smiles again at the end, under another view, okay? So here is my approach for a Hollywood smile. Let's say it this way. We have to go through different stages. One of these stages is this analyzing the smile, okay? Analyzing the smile. And that is the smile design procedure, okay? But until we get there, we need to have the patient prepared for that, okay? So one of these things that we have to do is anamnesis, X-rays, model taking. Everybody knows about that, okay? We need to see things that might not be seen by everybody, okay? And then we make a smile design, and this person needs urgent help for something else, okay? You see the cyst here, okay? Then determine the occlusal line. Are the front teeth over, under the occlusal line? Then you also need to see, well, will I need to take a lot away from the tooth if I want to make a nice smile? Well, everybody knows if the teeth are very much in front or very much like aside or overlapping a lot, then I will have to remove a lot, okay? So how can I avoid to remove a lot? Well, let's think it through, okay? After that, we take the pictures, which is an extremely important step. We take the pictures, and I recommend to you to get professional assistance with that, so that you really learn to do professionally picture taking. For example, inside of the program of aesthetic dentistry of the Mastery Academy. After you've taken all the before pictures, okay, of the patient and inside of the mouth, you have a good documentation of everything, and you can show the patient later, listen, that's how you looked. Now, really, don't bother about this small thing you have there. Do you remember how you looked, Habibi? Well, sometimes they don't remember. Then, of course, we have to make sure that our periodontal and gingival conditions are okay. These conditions are not okay to make a smile design on this person. Okay? We have to go through all these treatment phases. So the previous treatment phases, before we really analyze the smile, the final smile that is healthy, okay, and where we can start to do a smile design, has to go through all these steps. I'm pushing this a little bit because it's so much that I have to talk about in so little time, in 1 hour, so that you can get all the information that you need. Now, we would start with orthodontics, and I recommend everybody who is a general dentist to get at least a clear align certificate, like Paris Align or something like that. Paris Align, okay. For example, is a competition to Invisalign. For sure, you can also take Invisalign. Now, this helps us to do minor orthodontics or little orthodontics to save the enamel and the hard structures of the teeth, and sometimes even save the nerves, so that we don't have to kill the nerves in order to make something beautiful, okay? Which would be, for me, of course, a red line. Don't touch the nerve ever, okay? Then better compromise instead of damaging the nerve. So orthodontics, sometimes, so the bite, how's the bite? You can even prep less if you do orthodontic first, or no prep at all, which would be much better. You can do normal orthodontics with an orthodontist, or you do Invisalign or Parisalign or something like that, okay? And then don't forget to make the retainers later. Also, look at the face. Maybe the person needs maxillofacial surgery, orthodontic surgery, okay, in order to really get a good smile. Has the patient a class 3? Has the patient a class 2? A very, very pronounced class 2. Okay, so these things are important. Then we look at if we do a whitening, for sure. Maybe we do the whole mouth with veneers. Maybe we don't do the whole mouth. If we don't do the whole mouth, whitening is very important. If we do the whole mouth, sometimes whitening is still important to have a good basis, not to take away too much from the tooth. And then at the end, with very, very thin veneers, have a very good outcome because we whitened the teeth and got a good basis with that. Then Gummy Smile. Gummy Smile can be addressed in several ways. One of the ways is with a laser, and but always you have to remember the biological width. Okay, the biological width is very important here. These is, for example, also a topic that we cover in Dubai in the aesthetic course. Then Gummy Smile can be done with open crown lengthening, only with laser, with a combination of taking away bone and with laser. You can learn about all these things. Here is a nice way to do a Gummy Smile by attaching the lip lower than it is attached right now, okay? So they just take away these areas of gum with, listen well, with the periost, and then they attach the periost that is up here to the level of here. So when the patient lifts the lip, it cannot go further than that, okay? So if they have a you see here how they attach that, okay? And after 2 weeks and after 3 weeks, it's completely healed out, and the patient doesn't smile as high as before, okay? This is also a possibility if the teeth are have the right size and length, and we cannot take away more of the gum, then maybe that is an option. Another option would be Botox right here. Sorry, go back and here. Okay, good. Then maybe endodontic treatment, maybe reendodontic treatment to have a overall health of all the teeth, which is very important to start a smile design. Okay. Then old filling replacements. Old fillings are usually discolored, leaking, and so on. So we need to replace them. A lot of them are amalgam fillings, and we just replace them and have a good basis for our smile design. Okay, good. Then we start to analyze the smile. And there are these smile design rules. The rules are, first of all, in the analyzing sector, and second of all, in the designing or planning sector. Let's say it this way, planning sector. Okay, analyzing and planning, two different things. Good. We can also do everything in one step in softwares. DSD, Dental GPS is one of them, or Ivor Smile with an app. You know, you've got this app here. I don't know if you will be able to see that. If not, then it's also okay. You see me. Oh, wait. Can you see? Can you see me? And I'm smiling and looking at a mirror with a new smile right now. Okay. So the patient can really see himself here and with a designed smile and smile to like in the mirror. Okay. With these softwares. Okay, one of them is Ivor Smile. I use it now a lot with my patients just to sell. These things are nice to sell, but we have to know what we want to change. We have to analyze what's not okay, and follow a path. One of these possibilities is that you create a smile evaluation form. Okay, you create your own, or use a template. The key is to have one. Okay, so sometimes, so that you don't forget any of the steps, you just put that in a form and you go through that steps. The patient has the impression that that you are very organized and that you know what you're going through, and that you are measuring everything, and the patient will get at the end a very, very personalized and very, very precise work. Okay, some of my colleagues, they do that, and then when the patient is gone, they just throw it away and they send everything to the lab, and the lab makes the whole design. And this is only marketing for them. Well, you can use it as marketing, but you can use it also as you know, as an analysis of what the patient needs and has. Where do you get these smile evaluation forms? Well, from the internet. Mine is in Spanish, okay? But I got mine from the internet, and I put it together, and then I translate it into Spanish, and I have it in Spanish, okay? But there are many out there that you can use. Good. So what are we looking at when we look at a smile? Well, a lot of different things, okay? A lot. I will talk about most of them in this webinar. Good. Evaluate aesthetics for every patient. First, tooth, gingiva, lips. This is one sector. Then smile, face, and then the individual. The basics of a great smile. First, gingival criteria. I will concentrate now more on the white aesthetics. That means on the dental criteria. Okay, there are some gingival criteria. I will mention a little bit some gingival criteria, but I will not get too much into the gingival criteria. By the way, I will discuss that in the course in the laser and crown lengthening and biological width seminar. Tooth criteria, which is very important to design the smile, and tooth arrangement in the smile. Okay, so analyzing the smile. Is everything according to the face? Okay, so is it, you see, usually the nose, the wings of the nose, when you smile, are on the level of the canines. Okay, that is a harmony. What one of the rules? Are there any scientific rules for smile design? No. What? No, there are no scientific rules for smile design. So there are only subjective rules, but there are some rules everybody can agree upon, you know, by saying, okay, if that happens, then it's ugly. And if that happens, it's beautiful. Okay, everybody can agree upon that. And these rules are the ones that I'm talking about today. One of these rules is that when the patient smiles, usually the canines are on the area of the wings of the nose. Okay, then the contrast points where people usually look at when they look at a person, it is the eyes, the corners of the eyes, and the canines and the corner of the lip. So we want to, for example, this is from the GPS system, okay, a software to analyze and to design the smile, okay? But today we will not talk about the designing with software. We will talk about analyzing by ourselves, okay? But here I help myself just for you to see several things with the GPS system, okay? We analyze the face, okay? The contrast points of the face, and we see, well, has the face a good distribution, okay? The good distribution would be that I have 1/3 from this green line to the yellow line and 2/3 from the yellow line to the menton, okay? That is where usually our incisal edges of the central incisors are placed. All the other teeth are not placed in that line. They are going up, okay, in a smile. Then we can also analyze, is the midline in exactly the where the nose is, but the nose in a lot of people is like here, there, up, down, I don't know, okay? And sometimes they even had some surgeries or even had some accidents, and then the nose is not reliable for us, okay? Usually it's the philtrum that is reliable. The philtrum is the, when the lip goes down and up, this depression of the lip, of the upper lip, that is the philtrum, okay? And that should be congruent with the midline of the central incisors, okay? When the patient smiles. Of course, sometimes that is also distorted. Cleft palate patients, it is distorted. Then also, if they got surgeries in the lip or fillers in the lip, badly done fillers, okay? A lot. But okay, and not only women. But okay, you have to touch. Is that lip filled or is it natural? Okay, good. Then the incisal edge positioned in the lower facial height. Okay, incisal and occlusal plane to upper lip line. Usually when the patient smiles, the upper lip line is the horizontal line, okay? You might think, no, it is the eyes. The eyes, the bipolar line is the horizontal line. Nah. Look at everybody. Do they have both eyes on the same level? Most of the people don't. Most of the people don't. And if we take this bipupillar line as the horizontal line and make our design according to that line, we might not have the real horizontal line, okay? But so where is the horizontal line? Here in the lip line. The upper lip is the horizontal line. Good. Now, is there a symmetry in the eye position of the patient? Okay, in this case, no, by the way. Okay, this eye is more out than this eye, according to the midline axis. Okay, is the nose symmetric? Well, more or less it is. Okay, but here we have a bigger nose on this side than on this side. Okay, the line is a little bit on this side. That's true, because the midline is a little bit on this side. Okay. is the symmetry with the corners of the lips. Okay, are the both corners of the lips really on the same level? Maybe on one side is more than on the other side. Who knows? Okay, you analyze that. Then the symmetry of the teeth. Do all the teeth go up the same level? Okay, the same way? Or is here a little bit more up than here on this side? So we analyze this. And these are the rules, by the way. And the facial rule is, here is Claudia Schiffer. The facial rule would be, according to Da Vinci, 1/3, 1/3, and 1/3 of the face. And again, as we saw, from here to the incisal line of the central incisors, it's 1/3 of this 1/3, and from there to the menton is 2/3 of this 1/3. Okay, good. Linda Evangelista. What else can we say? Well, we can say that if a patient smiles nicely, these corners of the lips are, according to the corners of the eyes, make a trapezium. Okay, and we need to see if everything is symmetric in the face. If it is not symmetric in the face, and we make it very symmetric in the mouth, maybe there is a distortion, a small distortion. Maybe we have to adopt a little bit to the face. Okay, later. Good. A full facial analysis using lines. You can make a picture and then use your lines. Okay, the inclination of the inclination of the canines follows the inclination of the outer angle of the eye with the outer angle of the lip when the patient smiles. Okay, see here, the inclination is parallel to eye, lip. Okay, and then we have to analyze if the upper teeth follow the lower lip line. Okay, here the upper lip do not follow the lower lip line. Okay, so the smile design, first thing is, I don't know if I can take it up. Okay, smile design, first thing is, step 1, establish the incisal edge position. Okay, so incisal edge. We said 1/3 and 2/3. Okay, there it should be. Here it's too high. You see that? The use of phonetics and the M sound helps to define the position of the lips at rest. The amount of tooth visible in this position is important as a baseline for designing the smile. The more tooth visible, the younger is the look. Here it's an old look. Okay, so you tell the patient, hey, say M, and then after the M, you see what you see. Okay, then central dominance. We need to have the two central incisors be dominant. Okay, they have to be dominant compared to all the other teeth. What's the length and width ratio, or the ideal length and width ratio of these central incisors? Well, it is more or less 80%. That means from 100% length, and the most pleasant length is usually around between 10 and 12 millimeters, okay, of length. Of this 100%, the width is 80%. Okay, so if we have, for example, 11 millimeters as length, then the width would be 8.8 millimeters, which is 80% of 11. Okay, if it is 90%, then the tooth looks too wide and too short. here you, oh, sorry, here you see that. Okay. And if it is less than 80%, then the tooth looks too long. Okay, good. Then both teeth should have the equal width and length. So you have to analyze. What about the gum? Is the gum covering more one tooth than the other one? Are both on the same level here? Do both have the same width and length? If not, can I take away a little bit of gum? Okay, and so on. Now, in two teeth of the same size, the lighter tooth will appear larger and closer than the darker tooth. These two teeth are same size, but this one looks a little bit smaller than this one. Okay, so we can also play a little bit with these things. If we have a small tooth, we can make it slightly lighter than all the other teeth, so it looks a little bit bigger than it is in reality. That's a part of the smile design planning, by the way. Okay, canines in male tend to be like longer than in females. Okay, that's also a rule. Then the width of the maxillary incisor is 1.5 width of the mandibular incisor. Okay, that's also a rule. Then you establish the incisal edge, okay, influenced by the smile line, okay, and the ideal length of the tooth is approximately a 16th part of the face length, okay, and 10 to 12 millimeters is the most pleasing lengths, okay, and the patient should be able to say F and V sounds very nicely. Okay, so in the lateral plane, how does it look? Is it inside of the, or it's too long or too short for that? Okay, you can make some provisionals with that length and let the patient say V and F sounds. Okay, and then does it follow the smile line? Smile line, okay, following the lower lip. Okay. And when the patient smiles, also from the lip that is exposing the teeth, okay, 2/3 is the where the incisal edge is, and then 1/3 is underneath it. That's also a rule. Okay, here it's too much, too down, too wide up when the patient smiles. Okay, how much do we show? Okay, the amount of tooth showing when lips are parted and relaxed, okay, is very important, because ideally we show 2 to 4 millimeters of the incisor is visible, okay, when we are relaxed and not smiling. If it is less than 2 millimeters, we need additional length. Okay. If it is more than 2 millimeters, it looks like, you know, like, I don't know, a horse. No? Then we have to shorten. Yeah, but if we shorten, it's too wide. Now we can shorten from the incisal edge, but lengthen on the gingival edge, maybe. Let's see how the patient smiles and how much gum the patient exposes when smiling, okay? These things have to be decided on the patient, okay? Then you develop the midline symmetry, okay? Midline symmetry. Where is the midline? In the philtrum. Philtrum of the lip is the midline, okay? So let's see, do we have the midline of the teeth in the philtrum? The midline of the upper arch is for a smile design more important than the midline of the lower arch, but we can analyze both, of course, okay, and tell the patient about both. Then maybe he accepts to do also veneers in the lower lip, in the lower mouth. So the dental midline follows the contact surface of the two centrals parallel to the long axis of the face. Okay, the long axis of the face is parallel to the midline. Okay, facial and dental midlines coincide in 70% of the people. That means 30% do not have it. Okay? For example, this lady doesn't have it. Okay, because the nose philtrum is a little bit more here than here. Okay, it's a little bit. Now it's up to you to decide. That's not a lot. Okay, I just don't mention it. Or you say, this is going to be a good day for me today. Okay, and you mention to the patient, listen, your midline is not at your tooth midline is not in your face midline, but I can help you. I'm your helper. Okay, and well, it's up to you. In this case, I wouldn't do anything, me, but mashallah, other dentists who make a lot of money would do something about it. Okay, so how do we prevent midline and canting errors? Well, great records and good lab communication. Now, the lab needs to know where is the horizontal line. Okay, where is the horizontal line? That's what the lab needs to know. We need to tell the lab where the horizontal line is, so they can do the veneers exactly following this horizontal line and going up from that horizontal line. If they don't know the horizontal line, maybe, you know, this upper jaw is a little bit inclined, a little bit, okay? And the dental technician puts these models exactly in the way that they bite, okay? And thinks that the midline of this teeth is the way of the horizontal line, and it's not a little bit canted. So he will do the veneers exactly like this. Now, the upper jaw is a little bit like this. Now the veneers will be like this. And maybe he should have made the veneers like this to be exactly on the horizontal line. But for that, he needs to know where's the horizontal line. And for that, we usually use, here, for example, the horizontal line is not according to the occlusal line. The occlusal line is not following the horizontal line. Okay? In this case. Now, how do we tell the dental technician about the horizontal line? Well, with a face bow. I get it. A lot of dental technicians don't work with face bows, okay? But then you have to think about, am I working with the right dental technician? But okay, let's keep that for another discussion. If we do not use a face bow, which would be the best thing to do, okay, to let the dental technician know where is my horizontal line, we can do a little trick, which is when we take the bite, that means the occlusal line, when we take the bite in this bite registration silicone, we can put this, like, you know, a pencil or a stick or something like that, okay, that is following the upper lip line if the patient smiles, or if you wish the bipupillar line, although if this bipupillar line is good at the patient, okay, but if he has one eye here and the other eye here, then the bipupillar line is not a good thing, okay. But we need to tell the dental technician, hey, this is the horizontal line. And so I have this, and maybe my teeth bite down like this right now. Okay, then the dental technician knows, hey, they are not straight, they are canted. But he articulates everything with this here, horizontal, this here. That means this here, horizontal. Okay, this will be horizontal. Good. That's a small trick. Then establish the gingival margin. Where how long will the gingiva go down? Okay. How much gingiva should we expose? Okay. Exposing 3 or 4 millimeter is a gummy smile. Too much. Okay. So it is much better if we only expose 1 or 2 millimeters. Okay. If we expose nothing, if a patient exposes nothing, usually he is afraid of smiling a little bit. Smile. Oh my God. A lot of patients come to my office like this, and I say, listen, after I've made the work, you have to go to smiling school, because you have to learn to smile and show your teeth. I cannot let you smile like this with my new veneers on. This is not possible, okay? Because they hide their smile, and they have hidden it for years or decades, okay? And now they don't know how to smile, okay? So it should be congruent, and there can be a 1 to 2 millimeter display of gingiva. If there is too much, we have to do something about it, okay? Okay, we established that. And then, yeah, we see it's between 1 and 2 millimeters, it's okay. Then we create the central incisors. There you can have a more rounded, more canty, more squarey design. That's up to you, how you want to design. If it is more squarey, it's more masculine. If it is more rounded, it's more feminine, for sure. Okay. Oval is more feminine. Yeah. A triangle, square is more masculine. Pointed in the canine is more masculine. Okay. Rounded in the canine is more feminine. So, but also, it's not only you who decides the design, it's also the patient who decides the design, because maybe the lady likes the hard fangs. That means really pointed canines. She has now pointed canines, and she likes that, and she wants to have that later in her final design too. Then we need to see if there is a golden proportion possible, which only goes until the canine, because if we follow the golden proportion more than the canine, it's a disaster, by the way, okay? Then you need to extend the smile to the corners. So from the canine to the corners, we have to fill it up, okay? Into the corner. So one of the things is the axial inclination. The axial inclination, okay, is the vertical alignment of the maxillary teeth. Okay, so they are not all straight. They cant a little bit, and this axial inclination, okay, is bigger if you would take this inclination and do the same inclination on the lateral incisor or on the canine, then they would incline like the red line. They actually do incline like the yellow line. Okay, so they incline more than the central incisor. So the central incisors are not straight. They are a little bit inclined, a little bit. The next ones are a little bit more inclined. The next ones are a little more inclined, inclined. Okay. So everything goes towards and meets all these lines meet at the belly, down here at the belly. Okay, they all meet there. So you see the patient, you see the smile of the patient, and you draw the lines of all the teeth so that they meet at the belly. And then you see, no, this one is out, this one is not in. So, and you write it down. Okay. And then you know what you need to do. You need to put a veneer in this tooth to incline it a little bit better, or do orthodontics. I don't know. Okay. What you have to do, but you have to do something about it if the patient wants a nice smile. They meet at the navel, the belly, navel. Good. Axial inclination affected by gingival shape, contour, and zenith. The line drawn through the long axis, narrow arch appears more inclined than a wide arch. That is not good. Axial inclination. Okay. That's going here, there, up, down. Okay. One goes to Paris, the other to London, the other to Istanbul, where my good friend and Habibi, Dr. Ahnaf, is. And one goes to Dubai, where my good friend and Habibi, Dr. Abdul Majid, is. Yeah. And then you extend it to the corners. Now, the corners, we call that the buccal corridor. The buccal corridor has to be filled out. Okay. If it is not filled out, the smile appears to be very narrow. So that is why sometimes 6 veneers is not enough. We need some more, okay, to fill out the buccal corridor. Sometimes we don't need more if the buccal corridor is filled out. We just need to whiten these teeth that are there, okay? So buccal corridor, you see, here is more or less okay, but here, wank, it's like somebody pushed these teeth in, okay? So we have to take them out. We need there at least minimum 2 veneers, the better 3 veneers in that side to have it at least at the same level as this here, okay? Too much. That's overdeveloped. You see, these veneers are too much, not good. You see also the bad thing of overdoing things. Yeah, good. So sometimes they are not enough. You have a negative space. You have to fill that out. You have here a negative space. You have to fill that out. Good. And then you design the shape, the texture of every individual tooth. Good. Then some, so the contact points of the central incisors are in the lower third part of the tooth. Between the central incisor and the lateral incisor, it goes a little bit up, and between the lateral incisor and the canine, it goes also a little bit up, more coronal. Okay, it goes up, up, up. See the contact area. That's also a rule. The embrasures is this space, this V form space, this space here, okay, has different angles between the central incisor and the lateral incisor. It's less than 30 degrees. Between the lateral incisor and the canine, it's 30 degrees. Between the canine and between the two central incisors, it's less than 30 degrees. This one should be here. I'm sorry about that. This here is the 30 degrees that are between the central incisor and the lateral incisor. This is the 45 degrees that is between the lateral incisor and the canine. And from the canine on, it's always 90 degrees. This is a 90 degree. Okay. Then the lateral incisor is usually 0.5, maximum 1.5 millimeter over the line that connects the incisal edge of the central incisors and the incisal edge of the canine. The same happens to this line on the gum. Okay, so it's 0.5 or 1 millimeter over and 0.5 or 1 millimeter under this line. Okay, that's the ideal appearance of the lateral incisor. That's also a rule. Okay, and color and other effects on a smile. Well, we can play with colors. What is color? Color is not an exact defined value, but a sensory impression. So if I say, what color is this? And you say green, it's everything except green, because it absorbs, this here absorbs all the colors except green that it reflects. It's reflected by it. Okay, so it's an impression that we have from some wavelengths that we get from energy that comes to our eyes, to our sensors, and we see it as a certain color translated in the brain. But the color has three characteristics. Okay, first the color tone, then intensity and clearness. The color tone is more or less what we call the color. That means red, green, or blue. That's the tone of the color. Okay, then the intensity is how saturated is that color, how intense is that color. So and the clarity, how much is it mixed with black, for example. A lot of black, less intense, less clear. Less black, then it is more clear. Most of the tones and the clarities and of the teeth is between 6 and 8. It's here. Okay, so the clearness in the upper jaw is 1, 2, 3. The number 4 is clearer than the number 3. That means then the premolar is clearer than the canine. Okay, and then we have the canine. Well, sorry, the second premolar and then the canine in clearness. Okay, in a natural smile. Now, if we do veneers, we tend to do all in the same color. Yeah, bluish, yellowish. In the lower jaw, it is 1, 2, 3, 4, and 5. Okay, we have two different materials in the tooth, which is enamel and dentin. Okay, and the light transmission of enamel is different than the light transmission of dentin. That means that most of our color is determined by the dentin color. Now, if we want to have an effect of more of bigger teeth, we have to make them clearer. Okay, some tones clearer than the others. This tooth appears to be bigger than these two teeth. It's the same size. Okay, this tooth appears to be smaller than these two teeth. Is the same. This tooth, it's the same size because it's a little bit darker. It looks smaller. Okay, play with colors. The full arch may appear narrower if you keep the lateral teeth in a shade darker than the anterior teeth, and wider if you keep the lateral teeth in a shade lighter than the anterior teeth. Okay, how do you take the colors? There are some tricks. Okay, take the color in the afternoon, avoid direct sunlight. The light of the lamp should have above or about 1,500 lux. The walls of the office and the clothes that you wear should have a neutral color. Women should be without makeup, and a blue cardboard next to the patient's face increases your sensitivity of your eye in front of the yellow tones. Okay, do not look at the tooth more than 5 seconds in a row, because you get fatigue and then you don't see the nuances. Take the color before you start working. The eyes are relaxed. What do? Usually I make the gripper for the provisionals, then I do injections, I make the preparation, I take the impression, I take the bite, and then at the end I say, oh, the color. Nah, not good, because my eye are not relaxed anymore. Okay, so the patient should be standing, moisten the teeth of the patient, moisten also the shade guide, and take the original color of the central third of the tooth. If you want to take the dentine color, take it on the cervical third of the tooth. If you want to take the enamel color, take it on the incisal third of the tooth. Okay, of course you can use machines for that, okay, that are precise. And what is really important? Well, what have we learned now? Okay, let's see these teeth that are mostly wanted by the patients. Well, axial inclination. This goes this way, this goes that way, that is in, that buccal corridor. What about this? Okay. No, we can do it better. Now, what about this? Buccal corridor, too much. Too much. Everything too much. Okay. Here, what? 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 Oh my God. Well, but natural teeth and a beautiful smile. I cannot say it's not a beautiful smile. It is a beautiful smile, okay? But if my patient wants that smile, I cannot make it. Okay. I could do it better for the patient, okay? Not for Julia. Julia looks great like that, okay? What is really important? Well, listen to the patient, what the patient wants. Their subjective aesthetic desires should be your guideline, okay? And the communication of the treatment options is very important. And the patient is right. Keep that in mind. And the patient is right. And the patient is right. He's always right. So I want to conclude this 1 hour lecture right now. Okay. And I hope it has been helpful for you guys. You get in the chat section, you get the link in the chat section to know more about our program in aesthetic dentistry that is going on. It starts in August in Al Khobar, okay, in the Kingdom of Saudi Arabia, and it starts in September in Dubai, in the United Arab Emirates, okay? And I hope I can see you and get to know you there. Now I pass over my microphone back to the team and say bye-bye.